When a loved one expects to die at home. An informative video about palliative care in Nova Scotia, created by Caitlin McLean, Kelsey Faulkner, Jessica Ham, and Alicia Jacquard.
Why do people choose to die at home? Most Canadians state that they would prefer to die at home, surrounded by family and loved ones. However, nearly 70% of Canadians die in a hospital. Since this is a desirable option for so many people, families need to be informed about considerations and preparations involved in a home death. This video will outline some important information and available resources for family members preparing for the death of a loved one at home. Planning for the death. Talk to your healthcare team about the paperwork required for a home death. If you do not have the proper paperwork, there may need to be a formal investigation. It's important for your loved one's preferences to be known. You should encourage them to record their preferences in a personal directive, also known as an advance care plan. What is a personal directive? It is a legal document that allows an individual to make decisions about healthcare preferences, which will be respected should they become incapable of making informed decisions. This ensures that your loved one will receive the care that they want if they cannot speak for themselves. Personal directives are important to clarify cultural and spiritual needs before and after death. You can find more information about directives in Personal Directives in Nova Scotia booklet, which is available online.
Palliative care. Palliative care improves quality of life by preventing and relieving suffering. Palliative care services can include personal care, housekeeping, and nursing care. They can also support family during the grief process. The cost of palliative home support services is based on your income, so you may or may not need to pay for this service. Caring for a dying family member can be financially, emotionally, and physically exhausting. There are many resources available within Nova Scotia that can help with the burden of care. For example, palliative home care services are available to help with nursing care and home support. What to expect before and during time of death. When your loved one is approaching the end of their life, it can be very distressing for everyone. Knowing what to expect can help. Some common physical signs and symptoms include skin that has blotchy, red appearance, skin that feels cool to touch, especially in the arms and legs, restlessness, longer periods of time between each breath, and breathing may start to sound congested or gurgly. Your loved one may start to have visions, such as seeing a white light or seeing some of their loved ones who have already died. Hearing is one of the last senses to go when someone is dying, so don't be afraid to continue to talk to your loved one until their last breath. Please keep in mind that pain control is very important for someone who is nearing the end of life. Pain does not need to be part of death, so your palliative care team can help you and your loved one with this. Aftercare. Following the death of your loved one, postmortem care will need to be completed. This includes washing and dressing the body. Washing a body is a very intimate experience and should be done so with respect. Above all, it is important to continue to respect the individual's dignity and personal wishes. Washing the body should be done before the body stiffens. This typically occurs within 2 to 7 hours after death. You should plan to have more than one person present, as this will be necessary to gently move and turn the body. Some people are not comfortable giving postmortem care to a loved one, and that's okay. Talk to your palliative home care team or the funeral director if this is the case. Deportation of the body. Following the death of your loved one, a death certificate will need to be completed. One section will be completed by the funeral home or healthcare team, and another section will be completed by a physician. A doctor will need to pronounce the death, but the process may vary, so be sure to clarify this with your care team. How will they be transported? After death, take as much time as you need with your goodbyes. When you are ready, you can contact the funeral home for your loved one to be picked up. If these plans are not in place before the death, an ambulance may need to come, which may be distressing for family and friends. Planning a funeral. Before the death of your family member, it is important to discuss their wishes pertaining to their funeral. Cultural considerations play a major role in funeral planning, as they can impact the timing, necessary preparations, and location of the ceremony. Some individuals choose not to have a funeral at all, and this is okay as well. Dismantling the sick room. Cleaning out the sick room can be an intimate process, and can be a therapeutic way of celebrating your loved one's life. When to dismantle the sick room will depend on your personal grieving process. Some people wish to have the room cleaned out immediately, while others prefer to wait. When you are ready, you may want to have someone with you or close by for support. There may be special guidelines for the cleaning of the room, depending on if the person was using certain medications or if the person had an illness that can be spread to others. Taking care of yourself. Prioritize your own needs. Make sure you get enough nutrition, physical activity, and rest while you are supporting your loved one at home and after death. Be careful about using unhealthy coping methods, especially if you find yourself turning to alcohol or medications to deal with stress. Supportive family and friends can be a great resource for social support. If you find yourself struggling, the healthcare team can connect you with additional resources and supports. In conclusion, supporting a loved one in dying at home can be both challenging and rewarding. Knowing what this process involves and taking a proactive approach to planning can reduce the stress and demands associated with caring for your loved one at the end of life.